Greetings, colleagues. Okay, I see a question from Veronica on how can we participate the fiscal meeting in Dar es Salaam in October. So the forum will be held alongside the Tanzania Health Summit on the 2nd of October. So if you go to Tanzania Health Summit 2025 and once you're registered for the summit, our forum is open for everyone's participation. Yes, so you can go through the Tanzania Health Summit website, and then you'll find all the instructions on how to register. Either ways, in the next few days, we'll also be putting up the same links and instructions on how to participate in the forum on our websites and our social media. Mm. Oh, so So thank you everyone. As I said, we are just waiting for more others to join. We are now in a good number to start. And I'll start briefly by introducing again to all of you the Amplify Health and Development in Africa briefly, and why we started having this series of conversations. Just so we'll be starting. And I hope all the guest contributors, please, if you are invited as a guest contributor and you are on the call right now, please indicate that on my inbox. You can just write on your message so that we can start with the guest contributors, and everyone will try as much as we can to have everyone willing to contribute in this conversation. So my name is Alois Urasa, and I'm an interim executive director for the Amplify Health and Development in Africa, AHDA, an organization that was founded by young people inspired to engage the communities to further support on addressing climate and health, as well as health system strengthening. I'm trying to pull my brief presentation here. Unfortunately, there's so much running. Sorry, I'm just pulling a presentation and I'll be good to. So AHDA, as I just shared, is an organization that was established by young Tanzanians in 2022 with objectives to address the impact of climate change on health, particularly infectious diseases, mental health, and health systems. to ensure meaningful community engagement and youth engagement in health and development through advocacy, storytelling, community action, and strategic communication, and to support health systems strengthening through workforce development, policy advocacy, supply chain and logistics, capacity strengthening, health promotion, and health promotion. As our objective states, we have the three thematic areas on climate and health, community engagement, and health system strengthening. But our approach is through advocacy, storytelling, community action, and strategic communication. Some of our achievements, I'll not go deeply into them as we want to have more time for the conversation, is on training community health workers, running through a storybook for engaging students at different levels, especially at school level, through storybooks, creating climate and health clubs in the schools, and also engaging youth and experts through our partnership with Commonwealth Youth Health Network and Commonwealth Health Climate Network, as well as ANASO, CSO that is that runs multiple partnership with a number of CSOs across across East Africa, amongst other partners who have been really actively engaging with us in this series of conversations since last year, 2024, and this year we started a new series in May for that gears towards climate and health forum. We also look at strengthening health systems with the support on diagnostic support, supply of essential diagnostics, training of healthcare professionals, and looking into different areas of health system building blocks. We also run advocacy at different levels, from community to global level, and we have been profiling, collecting profiles of climate from the communities and sharing them in these high-level platforms, including COP, this Conference of Parties, and climate and health summits that we have done twice in Baku, Azerbaijan, and in in Brazil. Youth engagement, we have been training young people from the universities through our Unit to Kitab program. And as I've mentioned also, we are running different research to understand the best model out of the different engagements. These are just insights from the updates I've shared on high-level discussion, on storytelling. You can go to YouTube and you'll find some of the profiles we have shared, and on our website for more. On community engagement as well, with community health workers, with women and youth, health system strengthening, research, and those are some of the highlights on social media presence and our priorities going forward. I will be stopping my presentation and come to the deals of today. I'll look at just a quick reflection of what we have been doing. And please, you're welcome to introduce yourself, your organization, your name, your organization, your profession in the chat box so that the audience knows who is who in this call today. And so going through, since we started the series of the conversation, we started actually it's April, I keep saying May, I'm sorry. We had a conversation on climate change as a public health emergency and what could be an urgent call for action. And we had insights from a number of colleagues, including Aisha, who leads the Commonwealth Youth Health Network as a youth representative, who brought really insightful stories and examples from Pakistan and looking at how Pakistan is responding to a number of threats. As some of you who are into global health may understand the devastating impacts on malaria and other diseases that the climate-related disasters brought in Pakistan, similarly to many other countries. We had other experts, including Dr. Sham, and more other young people from Tanzania, amongst others. And then we went to a second conversation end of May, looking at the burden of climate-sensitive diseases And we had some young people and experts sharing insights on how youth are engaging in surveillance systems, in response, and in policy. And in June, we had a conversation on maternal and child health. And I know some of my good friends are here, Martina and others, and who have been really into the RMN surge, amongst others, who will acknowledge that there's a high nexus between extreme heat, floods, and everything in relation to maternal and child health. But again, we went further and looked at how young people can respond and how young people are already responding. In July, we had a conversation looking at mental health, climate change and mental health. And we had a lot of insights on how mental health is impacting maternal and child health. And to finalize the series of this conversation and doesn't really make it final, we need to have more conversations, more strategies, and going forward, more conversations and more action at the community level. This just marks for us a saturation point where we feel that we have some consolidated, well consolidated information that we could share with the public, but with the policymakers, with the community actors, with different strategists, organizations, CSOs. So the outcome of this conversation today, looking at global health governance and climate action, we are looking at positioning young people in response to this. And I'll go straight. I don't know if Farhan is on the call. You'll be the next speaker after Simon from Liberia. Simon, if you are on, please. Simon has prepared some examples from Liberia and has done a bit reflection on this topic. Simon will have 3 minutes or less to share with us the insights and the examples from Liberia to open up the conversation. And then we'll have Farhan, who has expertise on AI, digital health, to share with us insights on how these novel technologies would help us. We have guiding questions, which will go further into those soon. But I'll just like to have these two colleagues give us that a bit of opening, and then we'll have a third colleague for the sake of also hearing from the gender perspectives. Upendo, I'm not sure if Upendo, you're already in the call, but then we'll have Upendo sharing with us her insights on the gender impacts and how we could run this. And then we'll go with the list. We have a huge list to exhaust, but please just be friendly with time, make it short and straight to the point so that we have as many people in this call as possible contributing. Simon, please.
Yes.
Okay, thank you. Oh, you have the floor. Please, we have 3 minutes to highlight and share the examples from Liberia and your reflection on this topic.
All right. Thank you very much. Good afternoon, everybody. I am speaking currently from the border between the Netherlands and Belgium, so I'm very far away from home. My example, to correct the moderator, is from Sierra Leone. The last 5 years, I've been
Apologies, Sierra
working.
Leone.
The last 5 years, I've been working on my PhD and collecting data and ideas around youth, and the concept of youthness, and how that works with policymaking, power, and human rights, among other things. So I find this topic quite important, and I have taken the liberty to come up with a very short paper. And given the time constraint, I will just read out the outline, and then I will speak to the issues in the paper itself. So here is the abstract. My work currently, this particular presentation, examines the intersection between global health and climate action, focusing on how youth can be meaningfully positioned in the policymaking process. Drawing on philosophical analysis, because my work is from philosophy, my PhD is in philosophy. So I'm drawing on philosophical analysis and empirical data from Sierra Leone. And the normative framing in one of my most recent work, which is the Hope is a New Currency, where all the young people you speak to, the data collection, there is always one a strong team, which is hope. Everybody is hoping for better governance, hoping for economy, hoping for health, hoping for the climate. So the key word in a lot of all the key theme in most of these young people's framing and narrative building is about hope. Now, this discussion on hope situates youth not only as beneficiary of policy, but as strategic agents capable of shaping the future. It argues that youthness is a dynamic and relational category that must be understood within socio-political, and I might even add cultural context, and that the affective resources of functions the affective resources of hope functions as both currency and a catalyst in mobilizing youth for climate health action. The paper confronts the reality that youth have sometimes undermined their own collective agency, justifying calls for capacity, coherence, demonstrable competence before full co-ownership of decision making can be realized. Now, the global community faces a twin crisis, climate change and deteriorating public health system. The data for WHO and other relevant agencies abound. The WHO, for example, estimates that between 2030 and 2050, climate change will cause approximately 250,000 additional deaths per year. And this is in malaria, malnutrition, diarrhea, heat stress, among others. Now, when you look at the narrative around framing youth, uh, climate, and health governance, I would like to take a step back quickly and say that when I discuss youth from where I sit and from the data I collected, youth goes beyond just the statistics of numbers that we know, 15 to 19, 18 to this, I know the WHO, the World Health, the ECOWAS, and all of these things. It goes beyond that, especially from an African perspective, that the youth and the concept of being youth or youthness, it's more of a conglomeration of culture and contextual frameworks of where the young people are, whether they are rural, whether they are urban, whether they are in between, etc., etc. Now, when you talk about the youthness as articulated, you will see that in Sierra Leone, the social-cultural fabric is varied. A 30-year-old man can still be considered a youth, even 40-year-old man, if economic independence and social rites of passage remain incomplete. However, we can also see a very young man who is very successful, is under 30, and everybody, especially in Sierra Leone parlance, everybody calls him the pa or the father, even though he's younger than the person called the father, who has no children, is not married, but because of his economic status, he's no longer a youth. By our own definitions, they have become a father or a pa, somebody who is benevolent, for example. So when you go into the global infrastructure landscape for youth inclusion, international frameworks have progressively formalized young people from 2009. Going forward, we have worked increasingly to formalize youth participation. The UN major group for children and youth, the constituency of UNFCCC, the channels youth perspectives into climate negotiations, the WHO youth councils, etc., etc. So the systems are there. The question that one wants to ask, and I present this as rhetorical, is when we bring young people to the table, are they part of the meal selection? Are they part of the menu formulation? And I leave this for the conversation going forward. Now, what are the barriers to meaningful youth engagement? Several factors persist. Absence of youth representation in national climate adaptation plans,
Can you
limited
make it short,
access.
please? I'm sorry.
Yes.
Yeah, we have the. Can you make it short, please, and so that we have
Yes.
others as well? Thank you.
Yes, thank you. So the meaningful barriers to meaningful engagement, as I've mentioned, they perpetuate cycles where your youth are cast as beneficiary rather than partners, and we are all guilty of is narrowing the space for substantive co-creation of policy agendas. What are the recommendations? What are the recommendations? We need to embed youth councils in climate and health ministries. we need to fund youth-led climate initiatives. And the paper will be available after Friday for people to read and understand what I'm trying to say. Begin to develop mandate accessible information, integrate climate health literacy into education. And finally, I think what all of this big English is talking about is we need to begin to move from tokenism to co-ownership. And by doing this, we need to position youth in policymaking at the intersection of global fund and climate action, and not merely about representation. It is a democratic and ethical imperative. And from Sierra Leone, I would say that this go beyond symbolic gestures and building enduring structures that harness in ingenuity, moral agency, and lived expertise of young people while holding on to accountable agency. Thank you very much.
Thank you very much, Simon. That really sets the ground, and I like how you brought it to the conclusion that we need to move from tokenism to ownership. It's not just about the participation of the youth, but having them owning the agenda. Farhan, if you're on the call, please, you have a few minutes to open the ground and bring some other insights from the changing world with the digital technologies, AI, and everything. Farhan. Farhan, I don't see you on, then I'll go to Upendo. Upendo, if you're on, please could you unmute? Okay, I'll just go ahead to Loazi. Is anyone speaking that I don't hear?
No, I don't think Loaz is on the call.
Okay, yeah,
But Cora is there.
Cora, and then I go to Cora. Yes, thank you. Cora, you have 3 minutes.
Hello, everyone, and thank you very much for giving me the opportunity or the chance to share my experience on this matter. I will obviously like to address most of the areas that you looking at, but due to time constraint, I think I will have to limit it to some a few areas so that I'll be able to comprehensively deliver something on those few areas. To begin with, I'm Cora. I will first introduce myself. I'm Omar Cora, and I'm a health advocate, to be frank. But something else pushed me into climate advocacy. That's a whole story. I don't think there is time for that. But currently, I'm a very active climate advocate and working with the UNFCCC Youth and Children Constituency, Yango, and serving as the advocacy co-lead at the health working group. So to start, some of the most important global priorities when it comes to climate and health from our end, it has to do with two main things. One is integration, and the second is strengthening. The strengthening aspect has to do with health systems. Health system strengthening is a very important priority, especially for the global south. We all know our health systems are very vulnerable to climate hazards, and with the nature of with our economic situation and the global south and the rate of poverty in the global south, it becomes a real challenge for to have a strong and resilient health system which can face the current climate challenge. It is something that it is a great priority that we need to look at all across all the levels, from national level to global level. And secondly, it has to do with integration. There's one thing everyone needs to know. Just like our last the last SB 62, we had a campaign on climate and health code below. and the campaign code is name is climate crisis is a health crisis. This is something that everybody needs to understand. Climate change had an impact on so many aspects of our life, but the greatest impact climate change had is on our health. It affects every aspect of health, from access to health to vulnerability and others. So there is a great need or great call to integrate climate and health policies, both at global levels, regional levels, and national level, most especially national level. And we realize that there is a great gap in that because during the last SB62 sessions, we realized that there was, I don't know whether it's delivered or not, but health was not given the coverage it deserved during the negotiations, which was not very good for us as climate and health advocates. I realized that health is broadly captured in only one negotiation track, which is the GGA, the Global Goal on Adaptation. And fortunately, I was part of the team that comes up with the global goals on adaptation, the indicators on global goals on adaptation when regarding health. And that was the only track or the only negotiation that fully covered health during the recently concluded SB62, and which indicates that there is a great need for advocacy in this area. There is a great need for integration when it comes to climate and health. And similar trend continues even at the national level. From there, I'm just trying to summarize this so that I could cover something of most of the areas that I want to cover before my time elapses. But I could go into details in each and every aspect of each and every area. The next thing I would look at is the positioning aspect of this positioning youth, which is a really important area. Because youth, the young people, women and children, likely should be the lead in all climate initiative or climate and health initiative. The role of the youth cannot be overemphasized in across every area when it comes to climate and health. The issue where the youth are facing right now is the major problem is that youth youth should be institutionalized. The youth seats should be institutionalized at national level. We find out that at the global level we have UNFCCs and youth and children constituency, which is institutionalized and fully operationalized. But when it comes to national level, most of the climate negotiations took part in the absence of the youth, and the implementation also took part in the absence of the youth. And that doesn't tell well because it will obviously not go anywhere. You know, the whole approach is not community centered, it it brings something different from the objectives we have. It has to be community centered, people centered. And when you talk of people centered, young people has to be in the forefront of that, and women and adolescents and children. So all should be included to have a proper inclusiveness. And there is another area that affects youth positioning or positioning of the young people in terms of climate and health is to create a mechanism for consultation. There should be a climate. When I say mechanism for consultation, this should be at national level first, because most climate and health or climate decisions are taken without proper consultation or without consulting the most vulnerable or affected communities, which most of the times are the young people, the women, and the children. So leaving this important group of people will obviously hinder the progress or deviate from the goal. And it has to be institutionalized. It has to be a requirement or something that a mechanism need to be in place in every country for a consultative and inclusive approach towards climate and health, which the youths need to be in the forefront. And there are some strategies also to move from policy to meaningful action. And those strategies are in place, and especially at the younger level, we develop some strategies. To start with, the most important strategy the most important thing to achieve this is a resource. We need to have a resource for community-centered approach. There is resource for climate and health, climate change, and the resource could be used for climate and health. Because I think climate change has one of the greatest potential in terms of resource mobilization, and it can be done on it from how to call it again, from aviation tax all the way down to manufacturing industry tax, carbon tax on all those. With that, a lot of revenue has been generated. So we're demanding that some of these revenues should be reallocated to community-centered initiatives, or which most of the times are youth-led initiatives at grassroots level, because it is important to have a bottom-up approach when it comes to climate and health, because those most affected people should be in the forefront, or should every initiative to start from or within, or they should be leading the initiatives in order to work. Okay, and also when it comes to translating global commitment into national action plans, I'm not. Are you getting me?
Yes, Cora, thank you. And you are off time, so would like to give more chance for more others to contribute, and you may come in also later on.
Okay then. Okay, I think then I will have to stop here. Thank you very much. Okay.
Yeah, thank you very much, Cora, for that insightful contribution and those insights around resource mobilization and having climate and health as a good spot for increased resource mobilization for health systems strengthening. I see some comments here, and if please you have comments, you can write on the chat, and we'll be happy to collect those as well. Sarah Birunchi is saying, in positioning youth, we need to build capacity and confidence. This can be done through training and creating awareness, teach them policy processes, rights and advocacy techniques, leadership development. There is need to mentor youth and community representatives to speak for themselves in public forums, peer-to-peer learning, facilitating exchanges where young people learn from others already in decision-making spaces. We need to create access to police spaces, media, and storytelling. Thank you very much for those insights, Sarah. And I will now like to call on another guest contributor, Joyce Valère. Joyce Valère, if you're on the call, please. Joyce? Okay, Joyce is not on the
I can't see Joyce.
All right, thank you, Lizzie. Okay, we can now go to Aisha, representing the Commonwealth Youth Health Network. Aisha, would love to hear your insights for at least 3 minutes, and then we'll proceed with other contributors. Please put your hands up, and I'll be calling on each one who wants to contribute, but please keep it as short as possible. I know the email said 3 to 5 minutes, but we are trying to look at the realities right now that with the number of participants, we are anticipating to have as many of you contributing, but with the number we have here, we'd love to have as many of you contributing, so please limit the time. So Aisha, you have the stage, and then please put your hands up if you want to contribute.
Hi, everyone. This is Aisha Ali. I am the coordinator of the Commonwealth Youth Health Network, and it's been a complete privilege working with the Amplify Health and Development in Africa team. They have been incredible in this journey for this capacity building series that we have centered on the climate change and health nexus. So I'm going to keep mine brief. I understand we're short on time, and I would love to hear from all of the other wonderful participants. And so I'm just going to raise one very important point. The panelists before have covered some very, very important points, as Alois graciously mentioned: resource mobilization, advocacy, campaigning, grassroots level impact. And just one thing that I wanted to kind of bring up from the health perspective is specifically health workforce capacity building. And the reason why I say that is because in this evolving healthcare landscape, our health systems are incredibly, incredibly different as compared to what they used to be a decade ago, 2 decades ago. The disease patterns that we're seeing, whether that's vector-borne diseases, we're seeing heat-related illnesses, it has all dramatically increased. And one thing the perspective I wanted to give as a medical student in Pakistan is our curriculum has not necessarily adapted to the needs of our healthcare system of today. And therefore, there's this huge gap in healthcare delivery that we can observe of what is actually plaguing the healthcare system versus what is being taught to our future medical and healthcare professionals. And so I think a very specific call to action after all of this, we covered numerous spaces. We covered maternal and child health. We covered mental health. We covered a lot of different nexuses within the series, is capacitation of the healthcare workforce. And just something that I'd like to really drive home for the upcoming summit. And that can include, increased climate literacy within our medical and public health professional programs. I know this is something that is not prevalent here in Pakistan, which is very unfortunate considering how climate vulnerable Pakistan really is. And so again, I just want to keep it brief so I can hear from the wonderful people in the audience, and just wanted to, give a little tidbit to have everyone to think about. But health workforce capacity building is of utmost importance if we are to adapt to the healthcare systems of the present, and also, unfortunately, of the future, because, this is an ever-evolving problem. And yeah, thank you so much for having me, and I really look forward to hearing what other participants have to say. So thank you, Alois.
Thank you very much, Aisha, for sort of giving that reflection from all the conversation we had, including around mental health and everything. And now I would like to, before I go to Deborah and Clemens, I see your hands are up. I'd like to go to have Martina will share with us for the next 3 minutes perspectives from Europe. So Martina, you have the space as well as perspectives on maternal and child health. Martina, you have the space.
Yes, thank you very much. Much appreciated. And greetings to all over my wonderful fellows, wherever you are, in which continent. I'm sitting here in Germany. I'm pretty much dedicated to global health, and I'm really being happy to see what you are really doing in all your brilliant work, and much appreciate and congratulations to everybody. It's really tremendous, and you are the future, and I think I cannot really, I'm really being happy having you here. And thank you to Alois, who is really a wonderful person, and thanks a lot to everybody. Now, from my perspective, I'm working since more than 20 years in international settings, more than less in Sub-Saharan Africa as well. I was a country director as well in the Pacific area in Papua New Guinea, but my love is honestly and my heart is in Africa. So far, and from the maternal child health perspective, I'm not almost an owner of my organization, Multi-Connect in Africa. I'm as well an Rotary Action as well, area coordinator and representative director for permanent as well for maternal child and reproductive and women health. And I can say it has a big impact. It has an absolutely big impact for health. Climate change is tremendous. We see it in a very big cases as well, not only in Sub-Saharan Africa or India, where I have been recently as well, for another purpose, for another international conference, attending there. Even as well, my colleagues from Latin America, likewise, all over. And here in Europe, I would say it's absolutely as well. I think we are not well prepared, I would say. I think it's affecting each and everybody, and the majority are, yeah, I would say they are children and women who are very vulnerable. And I think we have to stick together our heads and to make such a difference and how we can bring it in. I have quite a number of we have been drawn with my fellow and colleagues together some initiatives here, not only from the German perspective, from my international fellows as well. And when I just came back from Calgary, I met all my fellows all over the world from our international conventions there, and before at the 78th World Health Summit and Assembly as well in Geneva, where we had wonderful meetings with my WHO members. And I'm there in the WHO workshop as well. I'm included in this workshop and in these meetings there with my fellows for neonatal and natal care and adolescents as well, and Jews health and how we can make it happen to bring the Jews and even the future generation who will be quite affected, unfortunately. And you are the keys, and we need to support you fully, absolutely, to make such a difference. And this is even well seen here from our German side and the German government, and in different discussions over with organizations, that we can do it and only together. And I think we have to be well prepared what we can do, even with small and little things, in my opinion, as well. Agriculture and nutrition is one of the major points, that we can look for sustainability, and that we are, even in agricultural issue, we can do it differently and really to sort it out, and even to, I would say, in my opinion, to bring it to the community level and to the farmer level, because if they're well trained and they are knowing how to feed their families, and to introduce it as well to the women who are in charge more than less, they are the keys for families for sure. And then they can bring it at a rollout program to their own communities in all these areas where we are talking and coming here from international keys. I would say this is for health purposes important. Health and nutrition and agricultural values, we should never forget it, to get good irrigation programs in power. Even if we are currently seeing this, it's not so much rain anymore, or we have lacking A, B, C, D, but we have opportunities even to do cultural issues a bit in a changing manner, and even agriculture, foresting, to do it. I have seen it on my own side as well in Ethiopia. We do it in another way, even because Ethiopia, we know probably we had since a long time drought, and we are seeing it for a long time. But we have been planting different types of plants there agriculturally with our programs here from the German Welthungerhilfe, and for regards to all these issues. And I would say it's not only costly, we can do it with less costs, but with a lot of activities. And for mobilization, for each and everybody, we don't need plenty of millions of euros or dollars, however we are talking. We can do it with our own activities and put our heads together, and I think do some exchanges in this case and draw some ideas together, which should be not really, I would say, complicated. We are not going here for any academical purposes. We are not going for any further data analysis. And I really admire the friend and the colleague from wait a moment, sorry. Ich bin gerade in einer Präsentation. Darf ich dich gleich wieder zurückrufen? Danke. Danke, tschüss. Excuse me, was a colleague of mine. No, the case is it should be not really too complicated. We should really make it easy because it's wonderful that this colleague from Liberia, and I have a wonderful fellow from Liberia, Dr. Angela Winston, with whom I'm working hand in hand together as well here. And he had some great points, has been raising it out, but it is from the academical point, very wonderful. We need always data analysis for sure, and I see it in different ways as well, whilst going as well and working on mental hygiene, health, and other issues around. I think we can do it and draw it in a very easy way, that we are facilitating it and make it such easy, approachable, more than less for the community-based level, for the people there, I think, who are in need. We need an approach, not too complicated. We need it from the grassroots level. This is what I always like. We have plenty of policies, we have plenty of guidelines all over, and it's too many, in my opinion, and too much. I think we should everything make it more easy and more feasible and reliable for everybody, that will be sustainable and long-lasting. Yes.
Absolutely. Thank you very much, Martina, and thank you. I like also the way you concluded that we have too many policies, we have too many guidelines and documents, and now we need to make things more simple and feasible for the community, for more actions to be taken. I'll be coming to Deborah, then Clemens, then Patna, and back again to Cora, according to the hands raised. And now I'll just read from Baby Musamba. Youth should be included not only in a discussion, but also policy making and formulation without stigmatizing them, all of you from all diverse environment. Safia Mohammed Ali is saying about global health and climate initiatives this is not part of Ministry of Health. This issue is multifaceted for intersectoral action. It's an integral policy for high leaders to bottom. This whole of government and whole of society approach sustains political will and resource allocation, moving beyond a purely health-centric view to one that recognizes malaria elimination as a shared responsibility for national development. Thank you very much, Safia, for that perspective on ensuring that this health and climate is not just a health agenda, but rather a multi-sectoral agenda. Gilbert is saying, let's program also support persons with disability, because persons with disability suffer most on climate issues. When it comes on climate, health and disability is too much to persons with disability. When it rains, they suffer a lot to access health facilities. Thank you, Gilbert. Moses is saying, as a young global health advocate, I believe the really climate health victory will come when youth are not only heard, but empowered with resources, authority, and platform to implement solutions that leave no one behind. Violet is saying, Violet Mugeha, most need more capacity building from grassroots levels. Enoch is giving a number of points, including the air we breathe and weather conditions significantly impacting human health. He's talking of climate, extreme heat, drought, and food insecurity as effects of climate, spread of infectious diseases, and that we need policies to address this. Thank you very much for echoing the importance of this. And interestingly, Zafia is saying that in Zanzibar now, the problem of malaria is due to climate change, and youth aged 15 to 35 years are being more affected. This needs really important to engage the youth perspective. Thank you very much, Safia, for giving that example from Zanzibar, and that we really need urgent action that really brings everyone, especially young people. I'll proceed from Paul later on, and now let me welcome Deborah Ike from DHDC Nigeria. You have 3 minutes strictly, Deborah, and then because we have 5 more people after you.
Thank you very much for giving me the floor. I'm Deborah Ike. usually most people identify me as director of programs with the Global TB Caucus, but today I'm participating in my capacity as the executive director of DHDC Nigeria. For me, I think this conversation is very, very crucial. Crucial because, for so long we discuss health, in isolation. But I love this perspective, looking at climate change from the lens of health. And for me, my message today is actually from the front lines of health advocacy. Back here in Nigeria, where we have seen how climate change, is deepening the vulnerabilities, disrupting our health systems, is displacing communities and widening the gap, you know, creating more barriers to affected communities accessing healthcare services. And like all the speakers have said, it's affecting the global south so much. We've seen the flooding, the rainfalls, and everything undermining the agricultural sector, our livelihoods, and most especially our public health systems. With all of that being said, I've also seen comments here as to, there's need for capacity building, there's need for creating space for young people. But allow me to shake the table a bit to say we are having to discuss so much. It's already, a known fact that young people, we have access to technology now. We are on social media, and we have some of these technical skills to actually put the message out there. I'm challenging each and every one of us here in the room today. You do not actually need to wait to be called to the table. Make that table for yourself. Leverage the platform that you have. If you don't have a platform already, create that platform and be that change. Begin to use your voice in the smallest ways possible, not just speaking to yourself or to community members, but I think now more than ever, we need to begin to call our governments to action. We need to remind them of the commitments that they make to the SDGs. We need to make sure that we are holding our government accountable to put in place budgets, to create resilient health systems, create resilient systems that can respond, very, very critically to these issues, because these are not just issues, they are human rights issues. It's an issue of justice. It's a matter of survival now, and we are pushing for equity. So I really thank the organizers for this opportunity. From DHDC Nigeria, we are 100% committed to this mission. We're looking forward to working with everyone here and ensuring that we support the amplification, of that messaging, the emergency that WHO has already signaled, according to the first speaker. Happy to be here, and thanks everyone.
Thank you very much, Deborah, for those insightful contributions. And now I'll just read one more from the chat. This is from Poka Tenge. He's saying priority areas in global health and climate action. Key priority areas should focus on a holistic and integrated strategy that treats the climate crisis as a health emergency. Strengthen the systems to anticipate, prepare, and to respond to climate-related health risks. Thank you very much. And some people here are mentioning, calling for you to connect with them, for the audience to connect with them. Please go to the inbox, keep on introducing yourselves, and share your ideas on the chat, as well as connect with others as much as possible. Over to you, Clemens. You have 3 minutes. Strictly keep time, please. Let's not exceed, so that everyone has a space to speak. Over to you, Clemens. I think Clemens has just dropped. Then partner Siabutuba. You have 3 minutes.
Thank you so much, and good afternoon, everyone. Good morning, depending on your time in your location. So my name is Partner Siabu Tuba. I'm Executive Director for Youth Development Organization. We are here in Zambia. Just to say a sincere thanks to the organizers of this meeting. I think this conversation could not have come at a better time than now, where different voices are heard across Africa, across the globe, to reflect on climate change as it impacts different aspects of human life. For youth, it cannot be overemphasized. Youths and women and children alike are the most affected every time there's a climate extreme weather condition or an extreme weather condition that comes as a result of climate change. For Zambia, we are just moving out of a season where we had a complete failure of rainfall, and a national disaster was declared because our agriculture sector failed. And our economy is basically agriculture-led. So when our agriculture fails, then a lot of companies whose clientele depends on the support of farming community, they begin to downsize labor force. So the people that already lose jobs are youths. And yet we see government trying to put together different ideas, strategies, respond to challenges that will come as a result of climate change impact. What we have seen as a weakness really is a multifaceted stakeholder collaboration and creating a platform where youths can come through and say, this is what we think can work for us in an event we have a disaster arising from climate change. So the policies we have basically are really weak and they need strengthening. Going forward, what we need really is to see a public policy or government policy that comes for its creation based on blank sheet consultation, so that youth then can begin to fill in what they think can work for them when there's a disaster arising from climate change, or if there's a health challenges arising from climate impacts. So, but what is also lacking is a level of sensitization and awareness, because it looks like the jargon associated with climate change cannot also be understood by youths that, for example, are semi-literate and are in the rural area. So if you go to them and say, this is climate change, what is climate change in the local language? What are the impacts of climate change in the local language? And how can you forewarn these youths and women that when you see this kind of signs, then you know that climate change is in effect? Since climate change is said to be here to stay, the adaptation strategies now are supposed to be deeply established into national policies whose participation in their formulation should not be a matter of invitation for the youth to come and participate, but it should be a matter of policy and need, that a blank sheet based consultation for information, for policy formulation, should ensure and guarantee a different segment of youths participate. But also those of us who are players already in the space, we need to break down the jargon that is associated with climate change conversation and ensure that we are communicating to everyone. Those that are literate, those who are semi-literate, including those who are unfortunate who have not been able to see and receive any amount of education. Thank you.
Thank you very much. That is really insightful. We highly appreciate. And now as I look for more hands, I'll be reading a few more here from Enoch, answering the question of how does climate change impact global health governance.
Thầy giải thích lên là năng lên.
Sorry.
Con mà này, con này để lên cái
Mute,
nhìn
please.
con. Dễ dậy đấy. Ghê thì như thơm.
Sorry. Oh, please. Let me mute you. Please, if you want to speak, raise your hand and I'll give the space. Clemens, you had left earlier. Sorry, I was reading some comments from Enoch. answering the question on the impact of climate change on global governance, and highlighting some key points around food security, influence on weather patterns, address and unity to address this. Evelyn from Kenya is saying youth are not just beneficiaries, we are implementers, innovators, and leaders. Give us space, skills, and resources. Thank you, Evelyn, so that we can really change the world. Gilbert again is saying, as you support youth, we should also think about youth with disabilities. Thank you. This has really been emphasized and cannot be overemphasized. Thank you very much. That's really critical. Our priority area in global health and climate action, we need to focus on point where the two fields intersect, because climate change is not only an environmental issue, but a major public health threat. I will proceed later on, and now I'd like to welcome Clemens, and then back to Cora. Clemens, you have 3 minutes.
Thank you. Thank you. I am Clemens Victor Moshi from Tanzania, from Rotary Club of Mwenge. I needed to also give my views about this issue of global health, especially on how to position youth and community more effectively in the policy making space. Here, we first of all is us youth to get ourselves engaged in the issues concerning about global and on global health, and also on climatic actions. Us ourselves, we should get out of the box and think out what can we do in order to make our climate a good area for us to live, and a good where we can have good health also. Also, it is now, it is not time to make strategies, but it is time to get into the field and to work on how we can make our climate better again. It is time now not to get into the field, to start activities, and the only people who can act in the field very actively, it is us youth. We should be very engaged, and we should engage ourselves in these activities so that we can have a good climate, and we can have a good global health in general. Thank you.
Thank you very much, Clement. Cora, over to you.
Okay, thank you very much for having me again. I just want to share an idea on collaboration and engagement when, mostly especially when it comes to health advocacy groups and community organizations. You know, at the UNFCCC Young level, we have different conferences for youth. We have what we call ALCOI, Local Conference of Youth, and the ARCOI, the Regional Conference of Youth. All this happens before COP, Conference of Parties itself. So in every country, there is a youth organization that has been awarded to carry out the ALCOI in every country, the Local Conference of Youth. And in every region, there is their organization, or an organization that is awarded to carry out the Conference of Youth and the Regional Conference of Youth. All this has normally happens in preparation for COP, Conference of Parties. So I just wanted to share this so that the civil society organizations in health and the community organizations in health, as we all understand the deep connection between climate and health, it is high time we start collaborating with these organizations at national level, and be part of the Conference of Youth at the national level, and the regional level, and then to the global level. It is really important because most of the advocacy activities happens at this level, especially, for example, with the ALCOI. It is done in collaboration with the Ministry of Environment in the countries of ministry responsible for climate change. So to have a inclusive approach, it would be really important to have health community organizations and health civil society organizations to take part in this, to highlight the health impact of climate change or climate the impact of climate hazard on health, which will be some kind of a beginning to foster more collaboration between the climate-led organizations and health-led organizations. Now, with this collaboration, there is a lot of leverage for advocacy and pressure on at national level to show that some of these policies, because to be frank with you, there are policies, good policies out there, but the issue is when it comes to implementation, that's where the problem lies mostly. So, and we need strong advocacy and pressure on governments, especially in our area, in the sub-Saharan Africa, especially, to
Yeah.
make sure they do the right thing.
Thank you.
And if you, I think it would be wise, I could share the link for every country's alcohol with Lizzie, so that I can share to participants, so that they will be able to they will be able to communicate with these organizations who are conducting the conference of youth locally, so that they will start collaboration from there. I think this will be something that will be helpful. Thank you.
Very helpful. Thank you very much, Cora. You can also put the links on the chat in case someone has a chance to keep looking at it after this call, and I'm sure Liz will also circulate that through the participants. Thank you very much.
I can share my email right now, but with regards to the link, probably after the call, I will go to my files and share it with Lizzie. Lizzie can then share it because I have communication with Lizzie, so she can then forward us. But yeah, but
All right.
I can also my email. Yeah.
Okay, thank you very much. And now, as we keep discussing, we had some key questions that most of the reflections have really gone through those key questions, but now just to echo again the questions that we need to answer through in that line. What should be the priority areas when it comes to global health governance and climate action? And how do we position youth and communities more effectively in policy making spaces? I know a lot of us answers and examples have been shared here, and in case you have more insights, please share, as we have a few minutes to go, around less than 20 minutes before we come to the closing session. And what are the best strategies to move from policy to impactful actions? Everyone has really been, most of the speakers have been mentioning that we have so many good policies, but how are we translating those policies to actions? And what is our position as young people? What are we doing, or what can we do better? How can we innovate to scale and sustain the progress? We believe that your expertise and voice can really shape and inspire some more actions. Over to you, Baby Musamba, for if you can use less than 3 minutes, we'll really appreciate, so that more people have chances to speak. Over to you, Baby Musamba.
Okay, good day. I don't know, it's in my side, it is evening now. Good day, everyone. Yeah, mine is to add on someone he was talking right now about to engage youth people in policy making. You know, as we all know, for example, from our side here in Tanzania, we are like in two sides. We are in southern side and eastern side. And we have this organ like SADC and EAC. For myself, I think it is better for youth to follow the line of the maybe SADC region or East African region to see if there is an opportunity for them to participate, like to build awareness and knowledge on youth, because we youth here, we are now in the webinar, but we have those youth who are very interior and they have no any idea concerning this issue. So we have to see the way so that we can reach out to those youth which are far from these social media issues, so that they can know. Because if we keep discussing here, it is true, we discuss and we find the way so that we can engage those youth. But we have to think about the youth who are very interior, maybe from social media, from town. Yeah, that is my view. Thank you.
Thank you very much, baby, for that contribution. I think it's really important that we think and do more in terms of reaching out the youth who are down there interiorly in the communities. How do we reach them instead of just like right now we have had these consultations more in person. But one thing is that through our research program and advocacy as well as community dialogue approach, we have also been going like recently we had dialogues with youth and community health workers in Lindi, that is in the southern part of the country. And we would appreciate to see more organizations, local organizations going down to those areas, having like bringing down these conversations to the community and not telling them what to do, but rather to amplify what they're doing, because there is a lot of locally led solutions down there. There are many brilliant ideas from young people. I'll read from Paul Katega again. He's saying in positioning youth and communities in spaces, we have to involve youth themselves and engage and empower them in as genuine partners rather than giving them tokens. Absolutely. We have to create a formula and mandated structure for youth and community engagement in policy and decision-making process. This will ensure their voices are heard consistently. Thank you very much, Paul, for sharing a lot of great insights through this chat. Youth isn't just the future. Youth is here now and needs to be actively involved and or have ownership. That is from KH Martin Coleman. Thank you very much. What measures are kept in place to ensure that the youth are truly involved? Aden Kule is asking, and I hope that's where we have had some insights about having those LCOI and different other mechanisms to engage young people. Peter is saying a number of organizations leave rural youth being because they do not appreciate the cost of data. To young people, online meeting is a cost to young people and a barrier to participation. This is very true, and that's why we need to go beyond these online conversations to offline and in or an on-ground conversation. Thank you very much, Peter Oit. Tayo is saying it's inspiring to see climate change and health being discussed together, but I keep wondering how can we make sure youth involvement in these policies is truly impactful and not just symbolic. Thank you. This is a question from Tayo. Maybe the audience can also consider as you respond. And not only youth involvement, Lizzie is insisting that not only youth involvement, but also actual frameworks for monitoring in the implementation, because sometimes we might have plans to engage the youth, but there is no really monitoring process to come and evaluate that. If we pledge to engage in a certain number of youth, how many have we managed to engage and how effective have our solutions been? I see Lee's hand is up, and I'd love to have your insights and responses to some of these complex questions, and then I'll go to Moses. Over to you, Lizzie.
Great, thank you. Yes, Alois, I completely agree. We do need to make sure that key populations, but also marginalized ones, like the youth within the rural setup, are reached out. But that's why organizations such as ENASO and AHTA are working with not only civil society or community groups that are within the urban setup, but also the ones that work within the rural setup. So as you know, ENASO is a consortium of CSOs and community groups, and we know very well we cannot reach everyone. So that's why we try and partner with community groups that still do door-to-door, discussions with youth. And we know very well we're talking about an era where there's a digital divide. Not everybody has access to smartphone or Wi-Fi as we speak. So we're trying to integrate the old school methods of communication still, and trying to also just bring everyone to this broader discussion, the ones who can actually access Wi-Fi. Adekunle, if you don't mind. Thank you. So I think ideally, whatever we're doing right now, it's just tip of the iceberg. Yes, we're calling on to collaboration and partnerships with other partners who can actually ensure that this message and all these concerns that we have here goes two-way. It goes higher up to reach the policymakers, but it also goes and trickles down all the way to communities who still don't understand what COP is and why they're meeting. But I also appreciate a comment that was made on the chats around funding. We know very well there's a lot of funding that has been directed towards climate change, and we're trying to figure out why they're not seeing that health is indeed the face of climate change. So we're also pushing that aspect of climate change and health. And that's why we're having such kind of deliberations, so that we know what's going on at the higher up policy level, but we also understand how this affects organizations such as ENASO, such as your organization on the call, and such as the rural communities that, are the ones that are actually impacted by the climate change impact. So I'll just stop there, but visibly call out to collaboration. We need to all work together, especially within the CSO space, as a united front. So Alois, back to you.
Thank you very much, Liz. We need to work together as a united front. That's really a strong call to action for the youth-led organizations across Africa and the Commonwealth. Let's work united, together, united as a common front. I see Taiwo is saying digital platforms give youth a louder voice than ever, but how do we turn that online energy into actual policy change in health and climate space? We are now on Zoom and we have all these conversations. How do we really turn this energy into actual changes or actual policy change? Thank you very much, Taiwo. That's a very critical question, and I pose it to audience. As I said earlier, this is an open conversation. We don't have keynote speakers to respond, but it's an open conversation for all of us to share our insights and ideas. How do we translate this energy into really policy change? Hi everyone, I'm Esley. Thank you. I like how we are looking climate change in all. This is from Rosanna. In all lens of health, and we should think what the strategies can we adopt to help women and girls, and we should think what strategies we could put as well to help them access reproductive health rights. We need more webinars for sharing knowledge. Thank you very much. This is really a great platform for us to keep and continue sharing knowledge across. Thank you. Now I'd like to go to Moses. You have 3 minutes or less. Over to you, Moses.
Okay, thank you for the opportunity. First of all, I'd like to say thanks for the opportunity to AHDA for this opportunity, because you are doing great job to amplify and to engage youth in this area of climate change and other stuffs about climate change. For me, I think for what you have been trying to highlight, I think I'm going directly to the priority areas in global health governance and the climate actions. I think we as youth, I think we have to stick on one health approaches, because in one health approaches, I think we as youth, we specifically, we need to address human, animal, and environmental health together, because if we're going to intersect or to integrate in this way in a one health approach, I think we're going to make big move. So as we go on, as we move on, we as a youth, we specifically need to focus on this one health approach. I think is going to be very good for us, we as a youth. And also in case of position use in community and policy making, I think you guys, you have been doing a lot for the youth engagement, because you're trying to create some platform for youth to reign, especially in these capacity building activities. Especially you try to equip young people and advocates together with researchers and policy makers to reign and get some insights on what we supposed to do or to amplify, so that we can create or position ourselves, we as a youth, in case of policy making activities, and also in case of moving to the policy and impactful action to the youth. I think we as a youth, we need your support, especially in case of funding accessibility, for the youth project, I think it's going to be very better for the youth to get an opportunity to amplify their voice or to engage in different activities, especially in innovating and also to implement their projects. You know, a lot of the youth, they get on a project, but they don't know how to implement. So you as NGOs, especially AHDI, I think you're doing a lot of jobs to empower this young generation to get some ideas on what they need to know, and on a way, in different way, they can implement their projects or activities in the community, especially also we as a youth, I think we need to make an innovation networks. So we need different NGOs to give us a platform to network, to communicate we as a youth, to create a good environment so that we can speak for the betterment of our communities and these vulnerable communities that needs our assistance, we as a youth, to implement these things. So we are so proud for what you are doing in this series, because we are the youth, we get a lot of fun ideas, a lot of fun insightful ideas from you, and we're so proud for what you have been doing. So we need you to increase number of these series, this platform for we as a youth, we can get on different insights and different ideas on how we can implement our projects and different researchers, so that we can make a change in our community. So I think I don't have many more to speak. This is enough for me. Thank you so much.
Thank you very much, Moses, for that. That's really important, especially when you talked of the One Health approach. It's a component that we need to understand way more and better. Reading more from the comments. Thank you. Young people must be asked the right questions. Bright shared a poster here from the International Youth Day, which says, young people must begin to ask the right questions from the angle of information to help localize their actions for the SDGs and beyond. They must begin to actively participate, engage authorities, and monitor the implementation of policies, and then align it all to how it would better their future. Thank you very much, Bright, for sharing this.
Are you sure? Which day?
Sorry, I didn't call you. Keep speaking. Strategies from Sarah Birunji. Many policies fail because they stay in documents instead of shaping really life outcomes. Set measurable indicators. Define what success looks like. For example, number of youth reach. Communication campaigns. Explain the policy in simple terms so that everyone knows their role. Participatory planning should involve people affected, designing how the policy will be implemented. Thanks for this wonderful webinar, Sarah, top-notch CDI from Uganda. Thank you very much, Sarah. You have been really among the champions of typing wonderful comments here. Before we start the final and the closing session, I have more comments here from Bright. There must be deliberate and conscious efforts to get the youth involved. In Nigeria, the youth are still very engaged, especially in many adults, as many adults occupy positions that are meant for youth. We must not stop and would continue to push. Special thanks to the organizers of this event has rejuvenated our zeal. Thank you very much, Bright, and we look forward to amplified action out there. Alice is saying, for our community to grow, both men and women need access to good healthcare, life skills, support networks, and funding opportunities. As youth and community groups, we can create safe spaces for learning, link people to health services, mentor them in business and leadership, and connect them to grants or microloans. When everyone is healthy, skilled, and supported, they build better lives for themselves and lift the whole community together. Thank you very much, Alice, for that great comment. We really need to strengthen and build skills for each other, and especially consider also the financing part, so that people have build all those necessary skills and needs to attain a better health and build more resilient communities. We only have 5 minutes before closing, 5 minutes and a few seconds. If there's any other hand, I would love to give you 2 minutes. I've always been saying 3 minutes, but I discovered for some 3 minutes for them a bit longer. They go up to 5 minutes, but now it's strictly 2 minutes for anyone who wants to contribute to the conversation. I go once. I go twice. Baby's laughing because she spent 4 minutes and 30 seconds in a submission. Thank you for the webinar. Some policies are not made in consideration of the youth. If there is a digital platform to hear from the youth, it will go a long way to address this. Thank you very much, Hakim. Now I'd like to, again, to come in on behalf of Amplify Health and Development in Africa. I want to thank all of you for joining and to sincerely apologize for the technical issues that happened, that our technical team had not recognized that the link that was shared had only a capacity of 100, but it was resolved when we just started the call to allow more people to join. So on our behalf, if you find anyone who missed this because of the capacity at the beginning and couldn't have an opportunity to join again, please convey our apologies, and we have already resolved that, and we'll make sure to be able to accommodate more people in the future through these platforms, Zoom and amongst other digital platforms. As we
Alois,
yes, to go Gondwe, yes.
yes, yes, I've been raising a hand for so long.
Oh,
For all the people who have explained very well about the youth, climate change, and women. Mine, a critical one is we hear about global financing on climate change. Where is that money going? Is it trickling down to these youth in rural areas, these women in rural areas? How, as a platform, can we advocate that those climate financing should go directly to the Ministry of Health in countries so that they should have services, commodities for mental health, because mental health is an issue to youth, among youth. Thank you, and over.
Thank you very much, Gonda, and apologies that I had not seen the hand raised earlier. And that is really a critical point, that every time we talk of financing, we go to these big climate forums and conference of parties. We hear a lot of pledges, a lot of money being pledged out there about financing for climate, financing for different names, as as you might find it all over there. But where does this money exactly go? Does it really reach out down to people? And I think that's where we saw some comments here around having proper monitoring and evaluation frameworks, so that when we have platforms like this, then we have some good examples from different countries talking of when they receive this particular funding, or when they unlock this particular micro loans somewhere, when they got this particular training somewhere, then it has helped them translate their ideas into certain actions, and this has been the impact. So that's really critical to be able to track the global financing and see where that money goes. And really, this is really critical. And as an organization and through our partners, we'll really take it into consideration as we come to the outcome of this series of conversations. There are so many issues that have been raised. We might have to look at what are the top priorities that we could share, what are the solutions, what are the examples and stories from the community. And we welcome you. If you have any story that you want it amplified through our upcoming forum and many other platforms, please feel free to write to us through email, the one you received through. You can write through our partners as well, through ENASO. You can write through Commonwealth Youth Health Network, or Commonwealth Youth Climate Network, or reach out to us directly through our email on the website, info@ahdafrica.org, or go through our social media platforms, Instagram, X, formerly Twitter, or LinkedIn. And we'll be happy to really feature your insights. As a conclusion, sorry, someone is asking for that email, Africa. And also we really, on behalf of AHDA, we really welcome partners to reach to us if you are interested to partner with us in any of the fronts, as I presented earlier about the organization. Our thematic areas is on climate and health. We have community engagement and health system strengthening. If you're working on any of those areas, please feel free to reach to us, and we are happy. We always love to work in partnerships, so you're really welcome. The recording of this webinar will also be shared alongside the report. Yes, it will be shared alongside the minutes of the conversation. And as stated in our email, that we'll be developing some outcomes out of this, including our white paper and policy briefs, and this will be shared through the same emails you registered with and through our social media platforms. Thank you very much. It's now 1 minute past the time we planned to have this. It was supposed to be 1 hour and a half exactly, but now we have exceeded by a minute. We have no much to say. We know there's so much to speak on climate and health. There's so many ideas, so many stories to share, so many solutions and ideas for innovation. And now I want to again thank everyone who has been participating from the first webinar to this last webinar, and again welcoming you to join us in a physical forum that will be held on the margins of Tanzania Health Summit in Dar es Salaam on the 2nd of October. You are highly welcome. Again, if you go to the link, registration link, registration.ths.or.tz, you'll find different means of registration, and you'll be open to participate in our forum. Asanteni sana, merci beaucoup, muito obrigado, and vielen danke. Karibuni sana Tanzania. Thank you, and have a nice weekend.
Thank you.
Thank you.
Merci
Thank
beaucoup.
you.
Merci beaucoup. Merci.
Thank you, everyone. See you another time.
I forgot something. Someone is just reminding me here. If you are still on, if you want to have a selfie with
Thank
us,
you.
switch on your camera and we'll have that selfie of the climate and health conversation. If you're still on and you want to be in that selfie, you are more than welcome. All right.
Hello. No, be patient. Take craft card before you complete it.
The other one is declaration by
I don't know. Enter.
dates.
You.
Sorry, someone just called me from the call and I'm now back. Anyone who wants to join, I go once, twice, going to take it.
Thank you.
Anyone coming in? Anyone else? I took the first one.
Thank you so much for everybody, for your brilliant conference, for your brilliant speakers. It was really absolutely extraordinary. Asante sana. And I would say, yeah, thanks and God bless you.
Okay, thank you and God bless you too.
Thank you, and we look forward to learn more from what you're
I
doing.
hope you will share the pictures.
Sure, we will share them.
Thank you.
Yes.
Thank you. Bye bye.
Thank you. Bye bye. Have a wonderful weekend. Bye.
Thank you.
Thank you. Bye, Ma.